Hey, it's Dr. V, your favorite Psych NP. So these are the top medications that I don't prescribe as a psychiatric nurse practitioner. Now, right off the bat, I gotta tell you, if you take these medications, don't worry. You and your provider have decided what's best for you. This is not medical advice. Most of my videos are for other psychiatric nurse practitioners, other nurse practitioners, to be able to get a sense of what is in the field and to compare with other practicing psychiatric providers. And all the medications that I mentioned is mostly because I think there's better alternatives. Now, having said that, I will go with number one. The number one medication that I don't prescribe is lithium. Now, I know you have heard that lithium is great for bipolar 1 and in manic episodes, but I think there are better alternatives like Seroquel, like Caplyta. I think there are better alternatives that have less side effects. When you give someone lithium, you need to monitor their kidney function very carefully. You need to monitor lithium levels very carefully, and it has significant side effects. So if I do have to prescribe lithium, I try to do the extended release, but that's number one. Number two would be Tegretol or carbamazepine, and that's because there's better alternatives. Lamictal, lamotrigine is a much better alternative, plain and simple. Tegretol has a negative effect on the liver, especially if you use it at high doses. You also need to do lab checks to make sure that the levels are at a therapeutic level, and that can be worrisome, bothersome for the patient, and a lot of times they don't do it. Number three is melatonin. I hardly ever prescribe melatonin. If I do, it's for a very select few of individuals in a certain population. And really the only time that I recommend melatonin is when someone's going to be jet lagged, when there's a time change of more than 4 hours. Otherwise, I don't use melatonin. Why don't I use melatonin? There's several reasons. Melatonin is not regulated. It's an over-the-counter medication. However, it should be regulated because it's a hormone that's released from the pineal gland. I don't know why it's not regulated. It baffles me. But basically, when you start taking a synthesized version of melatonin, your own pineal gland stops making it, and then you become dependent on it, and it's very difficult to get off of melatonin. You can ask those people that have tried. The fourth one is more of a general class, but I try to stay away from antipsychotics that are first-generation antipsychotics like Haldol, Thorazine, fluphenazine, all of those, because they have negative side effects such as increasing your risk for diabetes, increasing your cholesterol, and I think we have better alternatives. I think we have second-generation antipsychotics that have an added benefit because they also target serotonin. These include Abilify, Geodon, Seroquel, Zyprexa, Lorazepam. All these are newer antipsychotics. They're called second generation and they have less side effects. That's what I'm saying. We have better alternatives. And the very last one would be short-acting benzodiazepines such as Xanax. And this is because they are short-acting, meaning that they work quick, but then they are out of the system quickly, and then those symptoms of anxiety, panic, worry come back with a vengeance. And it can be worrisome because the individual might need to take that medication more often. They become tolerant and then dependent, and then they have a physical dependence where if they run out of medications, their body will go into physical withdrawal. So I try to stay away from short-acting benzodiazepines. I prefer a long-acting benzo. If I have to prescribe one, that would be like Klonopin or diazepam. Those are better examples of those are good examples of benzodiazepines with a longer acting period and less at risk to have someone become dependent on it. As always, thank you for watching. Thank you for listening. If you have any questions, go ahead and drop them in the comments, and I'll see you on the next one.